Hi, I'm Dr. Tom from Circulum. I'm going to talk to you today about a new technology called Remote Patient Monitoring, or RPM for short. If you're looking at this, then odds are your doctor thinks RPM would be a good idea for you. Before I get into all the details of how this works, let's talk a little bit about how healthcare works today. You go to your doctor a few times each year, they look at you, they ask a few questions, do a few tests, and get a snapshot view of your health at that moment. Your doctor has to base the treatment plan and medication for the next 3 to 4 months on a small glimpse into your health on that one day. Here's another way to look at healthcare today. Most people remember the old Viewmaster toy. You click from slide to slide and get little snapshots of a movie. You have to fill in the rest of the story yourself. That's kind of what the doctor has to do when they see you just 3 to 4 times a year. Wouldn't it be great if the doctor could get a full high-definition IMAX version of your health story? That's where RPM comes in. It fills in the blanks and gives your doctor better information about your health, medications, and the best treatment options for you. Circulum's RPM program is a new tool that takes healthcare from the old Viewmaster to the age of IMAX. Here's how it works. The doctor takes a look at your health history, asks a few questions, then designs a monitoring program just for you. A few days later, you get a package in the mail with all the equipment you need for monitoring. It might be a blood pressure cuff, a scale, a thermometer, or whatever device your doctor recommends. After the package arrives, someone from Circulum's care team will give you a call and get you all set up and running. Then, every day, you take a couple of minutes to check your blood pressure, answer a quick survey, or watch a video from your doctor. Your Circulum coach will check on your readings every day. If something doesn't look right, they'll give you a call. Or they'll send a note to your doctor. Or they can contact your office directly about your condition. With the RPM program, you can message or talk to your Circulum coach just about any time, and you can even set appointments to do telemedicine visits with your doctor. What's really great is that the next time you go see your doctor, they'll have a full history of all your health information since your last visit. They'll be able to see a lot of things about your health that they couldn't see before you had RPM. Here are some examples of how RPM helps patients. There's a 50% decrease in hospitalization for people with diabetes. Overall, 30% fewer ER visits. If you do end up going to the hospital for a procedure, there's a 40% reduction in people having to go back into the hospital with complications. And 71% of people on an RPM and coaching program were able to lower their blood pressure. There are hundreds of examples of how an RPM program saves patients' lives and keeps them healthier. Maybe it's time for you to get started. All the computer devices, the software programs, and extra staff to do the monitoring might sound really expensive. It's not. The people at Medicare found that a patient who did remote patient monitoring stayed healthier and didn't have to go to the hospital nearly as much as those who didn't monitor. They also found out that for every dollar they spent on RPM, they saved $10 in other healthcare costs. Here's more good news. RPM is covered by Medicare and a lot of other insurances too. Your provider will check for you. The bottom line is, RPM helps people stay healthy, out of the hospital, and happily in their own homes. So that's pretty much how things work. Thanks for hanging out with us for a little while and learning about RPM. The next thing to do is to give your provider a call and set up your own personal monitoring program. You can also visit us online at www.circulumcare.com or give our care team a call at 844-404-1600. Thanks, and we'll see you soon.